Thanks for tuning into the Audiology Services YouTube channel. My name is Blaise Delfino, CEO and co-founder of Audiology Services. During this video, we're going to be discussing how to properly clean and care for your hearing aids. Just like other equipment you buy, if you take good care of your hearing aids, they will provide you years of enjoyment. Now, before we dive into how to properly clean and care for your hearing aids, I want to review the different parts of the hearing aid in and of itself. First, you have the body of the hearing aid, which houses the circuitry, and it's really where all the bells and whistles are stored, if you will. The second part of the hearing aid is the receiver, or commonly referred to as the speaker. This is what transmits the processed sound from the body of the hearing aid. You then have the ear grip, which creates greater retention to ensure that the speaker remains in the ear at all times. You have the dome tip, which has two purposes. One is for comfort, second is acoustics. And the final part is the wax guard. Now, the wax guard is so important because this protects the speaker from wax getting lodged in and creating further problems down the road. Now that we've reviewed the parts of the receiver in the canal hearing aid, let's review how to properly clean and care for your hearing aid. What we really recommend to our patients is first and foremost, wiping off your hearing instruments every evening after each use, because what this really does is this reduces the oil and the debris buildup. So what you can do, and what we recommend using, is the little cloth that typically comes with the hearing instruments. So after every use and every evening, just wipe down the body of the hearing aid. We also recommend wiping off the speaker and that ear grip. Now, if you don't use a cloth, or the cloth that I have in my hand right now, you can also use a Kleenex tissue. And with the Kleenex tissue, you can just discard the tissue every evening. And then we'll grab this other hearing aid here, we'll wipe the body of the aid, wipe off all that oil, wipe that receiver, and that ear grip. Now, as I said earlier, this ear grip, if you currently wear a receiver in the canal, you may not have an ear grip. It is optional, but the majority of our patients do have the ear grip. Next best practice when it comes to caring and cleaning for your hearing aids is using a brush to clean off your microphone ports. Now, for purposes of this video, we're actually using the Oticon More 1. And with these Oticon hearing instruments, there are 3 microphone ports. 1, 2, and 3. Now, we personally recommend to our patients to clean the microphone ports at least twice a month. Grab your cleaning brush, just gently brush over each microphone port. And again, this gets rid of any debris, dead skin that can get into the microphone ports. And it's interesting too, is that typically the microphone port that is closest and sits on the side of the head is often the microphone port that gets filled up the most. So we've cleaned up that right hearing aid microphone port. Now let's go over to the left. So 1, 2, 3. It's really, really important that you clean your microphone ports, because if you don't, that is going to affect the overall quality of sound and transmission of sound. Next, with regard to best practice of care and cleaning, is to change your wax guard. Oftentimes, we may get calls from patients and they'll call us and they'll let us know that their hearing aid just stopped working out of nowhere. Now, it's most likely due to a clogged wax guard. In order to change your wax guard, and if you wear domes, these are the domes, what you need to do, and what I recommend doing, is taking a Kleenex or your cloth, getting a good grip on that dome, taking that dome off. So we need to change that wax guard. What you'll do, you'll get a new wax guard. So there's 6 new wax guards that come in a pack for the Oticon More Open S. You're gonna take out one of these tabs. Now you can see here, this black pick removes the old wax guard, and that is the new wax guard that you're going to want to insert. So what we recommend is getting a really good grip on that speaker. What you're going to want to do is just gently insert the black tip first, remove that old wax guard, and then insert the new wax guard, and then you can throw this out. Then what you want to do is grab the dome, line up the dome, and gently push back on. Now, best practice too is taking your finger and just gently giving that a good push to make sure that it doesn't fall out. Now, some patients also ask, how often should I change my domes? Now, these domes are medical grade silicone, so they can last quite some time. We recommend our patients change the dome once a month. You also want to change the wax guard at least once a month. Some patients do produce more wax than others, so we have patients that need to change the wax guards once a week. Now let's change the wax guard on this right hearing instrument. So again, what you want to do is just grab hold of that speaker, use your cloth or a Kleenex, gently grab that dome. You can put some muscle into it, and then we're gonna replace that wax guard. Grab the hearing aid again, get a good grip on that speaker. We're gonna remove that old wax guard, push in, pull out, and then put in that new wax guard. And then you can throw that tab out. And again, grab the dome, line it up, gently push on the speaker, and give it a nice little push so you can sort of see an indent in your finger. So again, every evening, use the cloth, wipe off and wipe down the hearing instruments. We definitely recommend using the cleaning brush to clean the microphone ports of the hearing instruments at least twice a month, and changing your wax guards at least once a month. Oftentimes we get questions with regard to how do I keep my hearing aids dry? And here at Audiology Services, we recommend to our patients using the dry caddy. Now, for our patients who wear rechargeable hearing instruments, what you will most likely need to do is schedule a specific day or days of the week where you are going to use your dry caddy. The reason being is because if your hearing aids are in the dry caddy, of course they are not being charged, but what we recommend is turning the hearing aids off first and then putting them in the dry caddy. And that's a whole other video, but our disclaimer here is that if you do wear rechargeable hearing aids, we highly recommend coming up with a schedule that works for you, keeping them in 12 hours, keeping them in overnight, and it might work for you if you just put them in on a Saturday night. Sunday is typically a day where everyone's just hanging out at home. But again, whatever works for your schedule and you wear rechargeable hearing aids, see what works best for your use of and with the dry caddy. Of course, patients who wear hearing aids that are disposable battery operated, what you will want to do is use the dry caddy every single night. So what we recommend, dry caddy, just take that top off. These pucks need to be changed and replaced every 2 months, and you do get a year's worth in the packaging. So what you'll do is you'll take the hearing instrument, place it in the dry caddy box, put both of them in at the same time, gently place them in there. That ear grip's giving me a little bit of an issue here. Just want to gently place them in there and just screw that top back on. And now your hearing aids are being dried. Moisture often leads to corrosion, which then leads to your hearing aid not working really how it should. And if you have, a minimum of 0.5 microliters of moisture in your hearing instruments, that's enough to reduce the overall sound output by 30 decibels. So we highly recommend use of a dry caddy for our disposable hearing aid battery users every single night, for our rechargeable hearing aid users at least once a week, and again, see what works best for your schedule. Our team also recommends at least once a week using what are called audio wipes. If you are wiping off your hearing aid every evening with a Kleenex or a cloth, well, we're not really removing much bacteria off the hearing aid, and we really want to be able to manage the bacteria on the hearing aid because, well, let's face it, you're putting a piece of technology in your ear, and we want to make sure that it is clean and disinfected. So we recommend at least once a week using the audio wipes, which again can be purchased by visiting our e-store. And how you use and properly use the audio wipe is, of course, just grabbing the hearing aid itself, gently grab your hearing instrument, wipe the body of the hearing instrument, the speaker, the dome, and the ear grip. Of course, you'll also want to disinfect the right hearing aid because I have the left hearing aid right here. So you definitely want to use audio wipes, like I said, at least once a week. I believe this is a tub that comes with 160, but again, they can be purchased by visiting our e-store. And please, if you have any questions with regard to how to properly clean and care for your hearing instruments, we are just one email away. Now that you know how to properly clean and care for your hearing aids, you will experience years of enjoyment with your hearing instruments. And please, I encourage you, if you notice that your hearing has changed, call your audiologist and/or visit a licensed hearing healthcare professional. If you have any further questions, please don't hesitate to reach out to one of our team members personally. The information's down below. And please also know that if you're interested in learning more about overall hearing healthcare, best practices in hearing technology, tune into the Hearing Matters podcast, where Dr. Delfino and I discuss really cool stuff on the podcast that has to do with overall hearing healthcare. But until next time, hear life story.